Welcome back, guys, to day 16. Welcome back, guys, to day 16. And today I'll talk to you about two things. That's medication and bed, organizing your bed and getting the best sleep. So I'll spin it around so you can look at my feet. I can put some things up on the screen and I'll go through what worked for me and how it worked really, really well. So let's get into this. Okay, so here we are. It's only 2 weeks and 2 days since the operation, and a lot has happened. We have to talk about a lot of stuff today, and I'm going to cover a couple of things. Okay, so you have to just look at my feet and legs. Well, I'm going to put some things on the screen now to make it a lot better if you're just looking at something rather than me. So first thing we'll talk about is medication, including the whole from the get-go from the operation. So the operation consists of a general anaesthetic. Years ago, they did just a normal general anaesthetic, knocked you right out, very dangerous for your body, and it's really heavy on the system because it can cause dangers to your eyes and if you've got glaucoma or diabetes. Nowadays, they do what's called an epidural. Well, it's not an epidural, it's in your spine. It's a nerve relaxant numbing for the whole legs. And then they give you a light anesthetic to knock you out, to keep you just asleep like a dentist. And it's a very safe way going into getting your knees operated on under a very minimal amount of local or general anesthetic. Okay, so once you come out of the theatre, you go to ICU. They put you on a drip and all that stuff. It was pretty minimal. I didn't get much pain. I was awake the whole time. And that's when they give you some Panadol and some pain relief and some nerve pain, Lyrica, and they give you some Plexia, but mainly you got the two saddlebags on, which give you the administered dose of the local anesthetic for the whole legs. They go brrr every half an hour, and they give you all the anesthetic you need, and your legs are completely pain-free. You feel them all, but you just have no pain whatsoever. That's a phenomenal thing, and that lasts the whole time you're in hospital, and you have no pain whatsoever the 4 or 5 days in hospital. Now, if you do go, lucky enough to go to a rehab place, you got private health, that's when they'll take the bags off the night before. My anaesthetist said, the anaesthetist said, I want them off the night before so your body gets used to it. In the morning there was some pain. We bumped up the direct Plexia, which is direct pain relief, and that was a lot easier, and off I went to rehab. I arrived in rehab 14 days ago, nearly. Oh, not 14 days ago now, sorry. 10 days ago I arrived in rehab, and straight away this is what they do. Don't always listen to your nurses or doctors. Tell them what works for you and how your pain is, to tweak that a bit, because what they did with me is start at 6 a.m. in the morning and 6 p.m. at night, giving me 12 hours of Plexia long release, slow release to get me through the night. The problem with that is the Plexia they were giving me at 6 p.m. at night, the slow release for 12 hours from 6 till 6 was only lasting 10 hours till 4 in the morning. I was waking up at 4 in the morning, pain, then getting a fast relief, Plexia, then you get a double dose, then you're going through till 6 in the morning, giving another slow release. It's too much. So I just wound it and click to 9 p.m. So now I have my slow release at 9 p.m. I told them this, which I know lasts only 10 hours, which brings me around to about, say, 7 in the morning, which gets me through the whole night. Then I wait 1 hour with Panadol, and 8 a.m. I have the slow release Plexia for the whole day, which gives me roughly again till 6 p.m. at night that night. And from 6 p.m. to about 8 or 9 p.m. I'm going to get through Panadol again till I get the slow release for the night session again. And that's the rotation I was using. And the first time I used that, I slept from 11:30 at night till 6 in the morning or 7 in the morning, didn't wake up. When before I was getting the Plexia at 6 p.m. and waking up at 4 a.m. in the morning, sore and getting a heavy dose of Plexia and then knocking me out till about 8. It doesn't work that way. For you might get 12 hours out of your Plexia long, slow release for 12 hours. I was only getting 10 hours. In terms of Lyrica, or lyrical, where they call it, that's for your nerve pain release. I got rid of that. I didn't need it, and I didn't even notice it, so get rid of all that. The other tablets you have besides the Plexia and Lyrica, you have the blood thinning tablets. You've got to have those. You also have the gut tablets for lining your gut full of tablets. You've got to have those. And they also gave me Minoxicam, which I had before coming in, or Minoxicam. When I have that at home, it's an anti-inflammatory, which is great for knees, but it numbs everything. I was having that 1 to 3 days run out of that at home with my sore knees. I'd get one tablet, lasts for 3 days. Here they give me one tablet in the morning and one tablet at night, and that's also great. Doesn't affect your bowels. You have no problem with that. So that's where I'm at the moment after pretty much 16 days of operation. It's Plexia, long release, getting only 10 hours relief from 9 p.m. till 7 a.m. in the morning, and then 9 a.m. till about 7 p.m. at night. In between those little times that I'm waiting for the Plexia to come into my room, I take Panadol, and that's it. No Lyrica, and then the Minoxicam in the morning, and maybe at night if you need it. That's it. So if you stick to that, you'll have not much constipation, and you'll be okay. If you don't, you have a lot of constipation, and it's quite heavy. That's the worst thing about this operation, is that you're not getting any sleep and constipation. The pain is not the problem. And the operation being good or bad is not the problem. They work. They just robotic surgery. So that, I hope, covers up some of the talks about the medication and what you need to do. And when you get home, you'll be able to taper those down accordingly. So that's the medication talk. I'll talk to you now about the bed and how this bed, you get your best sleep on a tiny little single bed after being a side sleeper or a king or queen size bed sleeper on your own. This is a very important next aspect of the rehabilitation. Sleep is critical to healing, and when I started sleeping better, I was healing faster. We'll get into that. First, you must have the bed elevated, and all beds in hospitals have the same thing. They have this little arm that comes out the side. I think they're all the same company. This is your best friend. Watch this, listen to it click. It locks in. That is your best friend for side sleeping, to pull you around to go on your side like that. And I'll demonstrate it here, on this side here. Sleeping straight the first at least 6 nights in rehab is really important for keeping the knee flat on the bed, so you get that full extension, and you're not going to have it bent all night and healing the wrong way. When you get past 8 days, you need to then start to sleep on your side. You can do it, it doesn't hurt. You put your hand through here, grab it, and you swing, go to the side of the bed, so you're right at the side of the bed like that, and swing that over. To forget all this is just this all been ice on it, so it brings it all out. You bring this around, and you twist your back, and you have that position. And honestly, that is quite comfortable. If you're finding pain here, put a pillow under here to lift that up a bit, and that, because you're keeping that back leg dead straight, which is good for it. But this leg is the bent leg, which you're not supposed to do overnight, but it can move around and do that. When you do that, the first time you do that, you'll sleep like a baby, and you've got your hand to help you pull back to this. And you can just swap from side to side, grabbing this side here, like that, and doing the same thing by going to the side of the bed like that, and then bringing it that way over again. This will help you, but you won't be able to side sleep seriously for at least the first 7 or 8 nights in rehab, because you won't be able to, it'll hurt too much. Once you start getting better, you can do that side sleep thing. Really important. That's one of the biggest tricks. Next thing, the thing at the bed, end of the bed, that bit of the thing, in the morning, put your feet on it and push like a Pilates machine. Push and get the blood pumping through your legs by pushing at the end. It's a great example today. You can see how raised the internal scarring is, which is all going to flatten out because they're all gone cold and icy, and this is all coagulating here and trying to heal, but eventually that just flattens right out, as it is with the knee. It just flattens out completely. You have no problem there at all. But this is obviously a shadow, and also the worst after icing, it comes up. But I'm glad you can see what it looks like now and how it's going to look when it's all finished. You won't even see it. So elevation all the time, 100%, and make sure that you definitely, do that side turning will help so much more.